This Labor Day weekend, we're taking time to celebrate all the hard work people do every day, and that includes dentists. Today, dentists can minimize the labor and maximize the ease of creating beautiful smiles. Dentist Steve Marsh is here today to present some easy ways to work on your smile. Thanks for joining us, Steve.
It's my pleasure, Armin.
So, we don't have to spend months and months in the dental chair to create a great smile these days?
Not so much anymore, and especially we're coming towards the end of the year and kids are going back to school. So dentists today will work very hard on things like scheduling and making sure things are within your budget and how much work you can do, so we can do it over different segments. Scheduling is interesting. Even in our office 5 days a week, we're open at 7 o'clock because people like you want to get downtown, so get it out of the way, so to speak. So we're aware of that.
So, you know, you've been on the show, you've talked about bonding and whitening. Are those long-term work, or are those fairly quick these days?
You know, today we can do it fairly quickly. We always make sure that it works for the patient, and I'll always explain options. And there was a patient recently who came in, and she was actually doing this for her sister's wedding. And so you can see her teeth on the top were uneven, not as white as she wanted. And you can see, if you look at the before picture, those lower teeth weren't very straight. And again, she had only 6 weeks. So on the lower arch, we just did some reshaping, Armand. And the upper, we did some bonding, again, some reshaping. We did some gum contouring with the laser. Your question was, can you do it quickly? We actually were able to do that in about 2.5 hours.
Wow. All right, you mentioned that you can work with patients' budgets, too. Well, tell us about that.
Well, we understand that dentistry, depending on what you do, has an expense involved, and we want to be aware of that. So, again, before the end of the year, we want to maximize insurance. People have it for a certain amount of time. We also work with 2 financing companies, and these are pamphlets we actually hand out in the office. One's called Care Credit, one's called Springstone Financing. They'll even do, in many cases, 12 months with no interest, and if you want to spread it out, depending on the size of the amount of work you're having done, you can spread it out over a couple of years.
Some people, through their work, have dental insurance, and they should take advantage of that.
That's exactly right, especially because it's on a yearly basis.
If you have a major mouth makeover, is there a way to work it out so you don't do it all at once?
Yeah, and one of the things we'll often do is segmentalize things, and we'll usually listen to patients and say, what's your biggest concern? What else would you like to do? And we have some pictures of patients we've treated that way, again, segmentally. So here's a patient who came to me, actually a viewer of Golden Opportunity, recently retired. His wife sort of dragged him in and said, now you have time to fix your teeth. He had actually had 2 implants placed on his lower left, the viewer's right, and we actually restored that with permanent teeth. Again, that was his main concern. Let's make it so I can function and eat. And you asked, could we do it in stages? That was the first stage. Sometimes we need a major makeover. And again, another patient who was retired and for many years took care of his whole family and said, look what happened to my teeth, I let them go. His family wasn't proud of it. One of his grandkids said something about it. And so we went in and those are porcelain veneers on the top. We reshaped the lowers. Again, you said, could we be aware of it in terms of budget, in terms of schedule? Well, now he had time in his schedule, so we were able to bring him in to do that.
Great. Let's talk about Novocaine, switch gears for a minute. That doesn't take as much work as it used to.
No, and we have some really wonderful things. In our own office, we use a topical anesthetic that we have made for us. It's called Profound. You know, when the dentist puts anesthetic in, if you want to make the shot fairly painlessly, you can do this with rubbing this on, letting it take effect. I'd give it to you, but I think it would numb you for the rest of the show.
But you put that on, and then you give the shot, and so that numbs it, and you don't feel the shot of the Novocaine.
Yes, and as my dad taught me, you give a little at a time, let that numb up, and then proceed. And that really will make it painless. And even one other thing we have is Auraverse. And Auraverse is a different type of anesthetic. It's an anti-anesthetic, so to speak. And we use that after the procedure. For example, you come in at 7:15, Armand, we numb you up, you have to get down to work, you want to be ready to go to work. We give you an injection of Auraverse. You don't feel it, it reverses the effect, and so instead of being numb for 3-4 hours, it'd be tough to have meetings that way. Within your drive downtown, you're ready to go again.
Well, it's easy to have meetings after the Novocaine. It's just I drool all over my client.
We want to limit that drooling,
All right. Thank you, Steve.
My pleasure. My pleasure.
There's no need to work at avoiding a dental appointment. As dentist Steve Marsh has shown, the approach to a beautiful smile can be easy does it. To make your smile work for you, give Steve a call. His number's up next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, stress relief resources for family caregivers.